Hello dear students, welcome to my channel. I am Ganesh. So today I have selected some important MCQs on fracture. Okay, so I am going to discuss some important MCQs on fracture, and I have already discussed about the fracture in my previous video. Okay, so if you want to have information or knowledge about the fracture, you can visit my channel, and previous video you can go and see on fracture. Okay, so now let us discuss about the important MCQs on fracture. Okay, so all of you please listen to the class carefully and please watch the video till the end. Okay, so let's begin with the today's session, that is a important MCQs on fracture. Okay, so let's see first question number 1. Okay, question number 1. A life threatening condition that can develop after the fracture of femur is. Okay, so what is the question here? A life threatening condition that can develop after the fracture of femur is. Okay, option A atelectasis, option B pneumonia, option C nerve damage, and option D fat embolism. Okay, first option A. Option A atelectasis. Atelectasis is nothing but it is a closure and collapse of alveoli. So this is not because of a fracture. Okay, it is not happens because of fracture. So it is a wrong option. Okay, next one is pneumonia. Pneumonia is nothing but it is a inflammation of lung parenchyma. Okay, so inflammation of lung parenchyma is not occurs immediately after the fracture, and that is not a life threatening fracture. This complications of the fracture. Okay, it is a wrong option. Next one is nerve damage. Okay, nerve damage obviously happens second to the fracture, but it is not a life threatening condition. It does not cause life threatening condition. Okay, and next one is the fat embolisms. So what happens here? Whenever there is a long bone fractures like femur fractures happens, the fat present inside the bone will come out of the bone, and that will enter into the circulation, and that will enter into the venous circulation into the inferior vena cava. Then the fat emboli will come to the right side of the heart, and on contraction of right ventricle it go to the through the pulmonary artery, it go to the pulmonary artery, and then it will block the pulmonary artery or its branches. Okay, causing pulmonary embolism. So pulmonary embolism is the one which causes a life threatening condition. So the option D, fat embolism, is the right option. Okay, so what happens when the patient develops a pulmonary embolism? Patient will have a dyspnea, shortness of breath, hypotension, restlessness, irritability. All that will happen because of a fat embolism leads to pulmonary embolism, and that causes a life threatening condition. Okay, so fat embolism is the right answer. Next, question number 2. Complications of fracture is: first, nerve injuries, option B fat embolism, option C soft tissue injuries, option D all of the above. Okay, so the complications of fractures are: first one is nerve injury. Okay, because nerves are present around the bone, whenever there is a break in the continuity of bone, there is a chance of nerve damage or nerve injury. So this is correct. And fat embolisms, as I have already discussed, fat embolism is a serious complications of the fracture. Okay, so this is also one of the complications of the fracture. And soft tissue injury. Okay, so bones are surrounded by the soft tissues or visceral organs. All those are present, and bones are present around them. So there is a chance of obviously soft tissue injuries. Okay, so the complications of fractures are nerve injury, fat embolism, soft tissue injuries, all of the above. So all of the above is a right answer. Okay, it causes all the complications which are mentioned here. Okay, next, question number 3. Fracture of malleoli or lower end of the fibula is known as. Okay, what is the fracture of malleoli or lower end of the fibula is known as? Okay, option A Colles fracture, option B Hangman fracture, option C buccal fracture, option D is Potts fracture. Okay, so this symbol is a fracture symbol. Okay, so first one is Colles fracture. Colles fracture is nothing but it is a fracture of a radius bone. It is a fracture of radius bone. Okay, of the forearm. What is Colles fracture? Colles fracture is a fracture of radius bone, radial bone of the radius bone of the forearm, that is near to the wrist joint. Okay, so when the radius bone get fractures near to the wrist joint, so it is known as Colles fracture. Okay, it is also known as a wrist fracture. Okay, so this is not a right answer here. Okay, because they asked for fracture of malleoli or lower end of the fibula. They called. Okay, it is not a Colles fracture. Next one is Hangman's fracture. Hangman fracture is a fracture of a cervical two vertebral body. When the second cervical vertebral body get fractured or broken, so that is known as a Hangman's fracture. Okay, so this is also not a right option. Next is buccal fracture. Buccal fracture. So buccal fracture is nothing but it is also known as impacted fractures, in which bones are broken into 2 or more pieces, and that broken fragments are driven into one of the fragment of the bone. So that is known as a buckled fracture, or it is also known as impacted fracture. So this is also not a right option. Okay. Next one is Pott's fracture. Okay. Pott's fracture is nothing but it is a fracture of malleoli or lower end of the fibula. Okay. Whenever there is a fracture of malleoli or lower end of the fibula, okay, that is a lower extremities. So that is known as Pott's fracture. So the right option for this one is the Pott's fracture. Next one is question number 4. That is the repair and reconstruction of the joint is known as. Okay. The fourth question, the repair and reconstruction of joint is known as. Okay. So whenever the term repair comes, you try to find out plasty in the options. Okay. So here there is no plasty. It is arthrotomy. Option A. Option B is orthodesis. Option C is arthroplasty. Option D is the amputation. Okay. So here we can see arthroplasty. Plasty means repair. Okay. So here the repair has come. The repair and reconstruction of the joint is known as, that is arthroplasty. So right answer is arthroplasty. Okay. So arthroplasty is nothing but a repair and reconstruction of the joint. Okay. What is arthrotomy? Arthrotomy is a surgical creation of hole in the joint. That is known as arthrotomy. What is arthrotomy? It is surgical creation of hole in the joint. That is arthrotomy. Arthrodesis means it is a surgical fusion of the joint. Okay. Surgically the joint is made immovable by fusioning the bones. That is known as a arthrodesis. So arthrodesis is a surgical fusion of the bones of the joints and made immobile. That is known as arthrodesis. Arthroplasty is nothing but it is surgical repair and reconstruction of the joints. So that is arthroplasty. And amputation is nothing but a surgical removal of body extremities. Okay, body extremities known as amputation. Okay. It may be above knee amputation, below knee amputations. Two types of amputations will come here. So right option for this one is arthroplasty. Okay, the repair and reconstruction of joint is known as arthroplasty. Okay. Okay, students, continue with the next questions. Question number 5th. The diet recommended for fractured patient is option A, calcium rich diet. Option B, potassium rich diet. Option C, phosphorus rich diet. Option D, sodium rich diet. Okay. So here the patient had a fracture, and after the fracture, which diet we supposed to recommend to the patient? Okay. See here, the diet which will improve the bone healing and the diet which will faster the bone union. Okay. So that diet has to be recommended. Obviously it is a calcium. Calcium is the one which will improve the faster bone healing as well as faster reunion of the bone. Okay. So we have to recommend the calcium rich diet. Okay. Such as a milk and milk product, green leafy vegetables such as a spinach and nuts, etc. etc. Okay. So option A, calcium rich diet is the right answer here. Okay. Next, question number 6. Manual manipulation of dislocated shoulder joint is known as. Okay. See here, a patient had a shoulder joint is dislocated, and surgeon, okay, or orthopedician, manually he will pull and push the bone and bring the shoulder joint into the normal position. Okay. Bring back the dislocated shoulder into the normal position or normal anatomical position. So this is known as reduction. Okay. So whenever there is a fracture of the bone, if the surgeon or orthopedician, okay, so they will bring back that one by pulling or pushing of the bone. Again they bring back that fragmented bones into the normal anatomical position. That is known as reduction. Okay. So here the orthopedician, without opening the surgical joint, okay, without opening the joint, okay, manually he will pull and push and then bring back to the normal anatomical position. So this is known as close reduction. Okay. So close reduction means without opening the surgical site, without opening the fracture site, if you pull and push and bring back the bone into normal anatomical position, it is known as close reduction. And next, option B is a open reduction. Open reduction means the fracture where the fracture happened. So there surgically that surgically we have to open the area, and then reduction, the fracture fragments are reduced or bring back to the normal anatomical position. So that is known as a open reduction. Okay. And next, internal fixation means what we do here after the reduction. Okay. So we use a plates, wires or screws, okay, to keep that fracture fragment into normal anatomical positions. Okay. So that is known as internal fixation. So internal fixation is we will open the fracture site, we surgically open, and then they are brought into normal anatomical positions, and with the help of plate or screws or wire, they are maintained in the normal anatomical positions. Then after maintaining that one, the incision is closed. So this is known as the internal fixation. External fixation means here the fracture site is not surgically opened. Without opening, Okay, so manually the manual close reduction has to be done. Okay, the surgeon will do manual close reduction. Okay, that is a reduction of the bone. Okay, that is done, and after that, with the help of wire or some screws that are passed in the bony fragments, and they made a fixation. Okay, so that is known as external fixation. Okay, so the option A, close reduction, is the right option here. Okay, next is question number 7. Which of the following is a fracture in which bone is shattered into numerous fragments? Okay, they are asking which type of fracture where the bone is broken into more than 2 pieces or numerous pieces. Okay, so option A, displaced fracture. Displaced fracture is the one in which bone is broken and they are well separated. Okay, so that is a displaced fracture. Green stick fracture means the bone, it is a break in the continuity of the bone in which one side of the bone is broken, another side is bent. That is a green stick fracture. Okay, so this is also not right answer. Comminuted fracture. So comminuted fracture is a break in the continuity of the bone in which bone are broken into more than 2 pieces, and that small numerous pieces will be floating inside the body. That is known as a comminuted fracture. So this is the right option. And spiral fracture is the one. Okay, it is a break in the continuity of the bone in which the line of the fracture runs spirally along the shaft of the bone. Okay, the line of the fracture run around the spirally around the shaft of the bone. That is known as a spiral fracture. Okay, so option C is the right answer. Next, question number 8. What is the purpose of traction? Okay, traction is a nothing but it is a pulling force. See, whenever the fraction happens and there is a displacement of bone, pulling force is applied. Okay, and then the fracture fragments are brought into normal analytical positions. So this is known as pulling force. So this pulling force is known as a traction. Okay, so this the purpose of traction is, okay, option A, decrease the muscle spasm. Yes, obviously the traction will decrease the muscle spasms. Okay, option B, it reduces the pain. Okay, traction is obviously reduces the pain because once the muscle spasm is reduced, what happens here? The pain will also reduces. Next one is option C, immobilize the fracture part. Okay, so traction is the one which is used to immobilize the fracture part. It is also right answer. Okay, so option A, decrease muscle spasm. Option B, reduces the pain. And option C, immobilize the fracture part. All of these are the right answer. So option D, that is a all of them is the right option. Okay, so this is all about the questions discussion on fracture. Okay, so if you like this video, okay, please press the like button, and if you are the first time visitor, please press subscribe and press bell icon and share to other as well. Okay, so if you also want to comment something, please comment. Okay, so thank you for watching the video. Thank you very much.